Hi, everyone, and welcome back to the next episode of TILLY. I'm your host, Marissa Zeppieri. Some of you may already know me as Lupus Chick. TILLY is a weekly episodic series brought to you by the Lupus Foundation of New England. And tonight we have back one of our favorite guests, Dr. Maggie Cadet, and she is going to talk to us about a topic that a lot of you are discussing and asking questions about, and that is the COVID vaccine and lupus. So I call her Dr. Maggie. Dr. Maggie, I want to say hi, and I'd love for you to sort of reintroduce yourself to anyone that hasn't met you already.
Hi, Marissa. Hi, everyone. Thank you for having me back again. I am Dr. Maggie Cadet. As Marissa said, many people call me Dr. Maggie, and I'm a clinical rheumatologist. I've been in practice for over 13 years. I did my fellowship training at NYU Hospital for Joint Diseases, and now I am just taking care of patients in clinical practice, but I've done academic work. And I'm also an advocate for lupus patients as well as arthritis patients, and just here to try to make your lives better in every way by education and just having open discussions about treatment, diagnosis, and just living with lupus as well as other rheumatic diseases.
Thank you so much. Well, we are really excited to have you back. For those of you that haven't seen Maggie in the past, you can go back to some of our previous TILLY episodes where we talk about lupus nephritis, symptoms, what it's like, going to a rheumatologist and sort of getting that diagnosis and really all things lupus. But today's a little bit different because we're actually going to talk about the COVID vaccine. So I'm sure one of the most common questions you're getting right now is, should I get the vaccine, correct?
Yes. And this is a question that is, sometimes difficult for rheumatologists to answer because obviously this is a new arena for everyone, patients, scientists, clinical rheumatologists, primary care physicians. And we are really in a pandemic, which has really, we've all struggled with the past year, and we've seen the complications of COVID, anywhere from ICU hospitalizations, death, clotting disorders, multi-system disorders and failures. So I understand the patient's hesitation in getting the vaccine. And as a rheumatologist, I've been trying to follow up with the CDC as well as other guidelines. And currently the CDC, as well as the American College of Rheumatology, based on the CDC guidelines, are encouraging patients to get the vaccine, but also have discussions with themselves, like serious discussions with themselves, as well as the rheumatologist, about what their disease is like, how severe the disease is, what medications that they're on, any type of allergic reactions they've had to other vaccines in the past, as well as regular allergic responses, and really what their values are and their belief systems in the vaccine. Every individual is different. Every patient is different. No one patient is the same, even with the same diagnosis. So this is a discussion that really should be taken seriously with your practitioner. But currently, because of the severity of the coronavirus pandemic, the CDC is encouraging that if the vaccine, the mRNA vaccine, is available, that patients should get it because the complications of COVID-19 may be more serious than the actual reactions that can occur from the vaccine or the flares.
Right. So I think that's like one of the most difficult things right now is it's not just an easy, black and white. Yes, I'm going to get it. No, I'm not going to get it. And obviously a lot of people are asking one another, are you going to get it? Did you get it? What were your symptoms like? We've had people online who've shared, they were completely fine after receiving it. And then others who went into a flare up or wound up in their doctor's office or in the ER just because of different symptoms. So it really, everyone's different. And I feel like it's very hard to use other people as sort of your compass on whether it's right for you. So I had asked you earlier before we started, just are there certain things, and I know you mentioned like being in the ICU or having a certain infection. So are there certain like contraindications right now that any physician would say, okay, right now, like you're not a good candidate for this?
I would say, based on clinical experiences and just from what I've been hearing and reading about, I would say most clinicians would probably tell their patients to possibly postpone, maybe not permanently not take the vaccine, but postpone the timing of the vaccine if they're currently hospitalized in the ICU, if they're having a severe flare, if they're on high doses of steroids or maybe some other IV medication. Again, it might be about timing, like, if you just had a medication like IV Cytoxan or IV rituximab or some other IV medication, it may be prudent or beneficial to wait a few weeks before considering the timing of the vaccine. But obviously, if you're currently hospitalized, it is something that most clinicians would probably say to postpone. Other things that may be something to consider, again, is if you've had a prior severe hypersensitive reaction or allergic response to another vaccine, such as the flu vaccine. Some patients do have anaphylaxis or severe allergic response. That may be something to consider as well in terms of taking the vaccine. So again, it's, every patient's different, but every patient has to make a decision with themselves after discussion with their rheumatologist or other practitioner. It's a shared decision making. They have to consider whether experiencing a flare is worth, maybe preventing the complications of COVID-19. And you have to remember that we don't know how each individual will be affected by COVID-19. Some people are asymptomatic. Some people have a mild runny nose and GI symptoms or loss of taste and smell. But there are other patients, again, who have been hospitalized with pneumonia, heart, lung respiratory failure. So again, clotting disorders. So there are really serious complications to COVID-19. And I think most people are concerned about that in the lupus community, as well as any other patient with autoimmune disease.
Absolutely. So there's something that you said that I have not heard before, and I'm not familiar with it. What is it about those specific IV medications, and what are they doing where you might want to postpone getting the vaccine right now?
Well, anytime you have an immunosuppressant, obviously it can blunt a response to a vaccine, but also they do, sometimes they do have side effects. Sometimes your white blood cell count may go down. Sometimes patients do have other, reactions like headaches or, other complications from some of the IV medications. And that could also occur with high doses of oral medications. But again, with some of these medications, you worry about neutropenia or thrombocytopenia, like low platelet count, low white blood cell count. If you have that scenario, you may be less able to fight an infection if that does come along. So your immune response may be modified to a certain degree. So again, it may be prudent to possibly postpone it. I'm not saying that the vaccine should not be taken altogether, but again, the timing of it may be postponed. So that way you have time to recover. And again, you can space out when you get the vaccine, obviously, and then, your medications.
Right. Okay. Well, thank you for sort of going into that a little bit more. And I wanted to ask you about just overall herd immunity and why that may not work so well here. I think in the past, people have had vaccines, and then if you're around them, you're sort of considered safe. But with this, though, they can still actually get COVID, correct? But it's just not as severe. It's still transmittable if they were around someone that hadn't gotten the vaccine.
Yeah, so we're still, again, this is really new to all of us. We're still learning about the spiky protein of coronavirus. Now we have variants out again, which is, also another concern, because variants, may make that person more susceptible to complications, or it may be manifested as asymptomatic disease. So that's what we're concerned about. Just because you've had COVID doesn't mean that you have mounted enough of an immune response and to someone else who may have a variant. And also too, we're still learning about asymptomatic spread. So until we know more about this, virus, years, again, it's only been 1 year, and a lot of these variants have emerged in the last few months. It is still recommended to have more protective immunity to get a vaccine. So, we are getting a lot of patients who are saying, I've been exposed to COVID, I've had COVID, why even bother? Because you still want to have a more immune response. And we still don't know how much immunity these patients will have. How long does it last? They're still doing studies on this. So it is something to consider for the patients. Even if they know someone who's had the vaccine, they still want to be protected. Again, we don't know much about the variants, and we still want these patients, because their immune system is low and they're on immunosuppressants, to be as protected as possible. So currently right now, if the patients are interested, the American College of Rheumatology, www.rheumatology.org, they do have some recommendations. There was a task force of a mixture of infectious disease specialists, as well as rheumatologists and people who had worked for the CDC, who basically have come up with guidelines. Now, this is not medical advice, because again, every patient's different. Every physician has to have a conversation with their patient, and every clinician has to make their own judgment based on what the patient is demonstrating in front of them. However, I do feel that they've done a great job in laying the foundation for different medications that patients are on, whether there is any modification to the dose or the timing of the vaccine, such as Plaquenil or steroids less than 20 milligrams. There are recommendations for these medications, as well as some of the other medications like Cellcept, mycophenolate mofetil, again, abatacept, Rituxan, Cytoxan. So please take a look at that and really read this, as well as discuss this with your physician.
Great, thank you for that. I want to actually just shift gears really quick. When you have a patient either come in or call because they maybe are already in a flare, but then they start having symptoms and they're wondering, how can they tell if this is a lupus flare, or are they actually, did they come in contact with COVID and they're having COVID symptoms? Are there certain things that you're seeing that for you, you know, okay, this is not lupus related, I want to actually test you for COVID?
In my clinical judgment, I'm actually just testing them anyway, because again, there's so many overlaps in terms of the fatigue, myalgias, arthralgias. The loss of taste and smell is very specific to COVID right now. So if they mention that, obviously I would have them tested for COVID. But again, the malaise can be both. And because these patients, again, are already immunosuppressed, I do have them quarantine, absolutely. But I am sending them to get tested. If the symptoms persist for more than 2 or 3 days, for sure, I have them get tested. Because, they may come into contact with other people. It depends on who else is in their bubble, who else is in their household. And again, we can then have a discussion about, if this is a flare, whether they're going to be put on steroids or any other immunosuppressants. So I am getting them tested, because again, also contact tracing is really important right now from a public health concern. So we want to try to get this under control. We do know that now there is another surge, really on the rise in the United States. So I think the more knowledge we know about who has COVID, they may get, who may have the variant as well, is really important. So if they have any symptoms, I just have them get tested. There's no downside at this point.
Right. Do you feel like the patients that you've had that have tested positive for COVID and are immunosuppressed, is it taking them longer than other people who are healthy to get over the symptoms?
Honestly, it's been very variable. I've had patients who come in, obviously, again, because of their lupus and their autoimmune disease, they generally have this, fatigue and malaise, which, obviously will not be conducive in helping to get over any virus, aside from COVID. But there are patients who have said, they've only had mild symptoms as well. So again, with COVID, it's been very variable. Even healthy people, really healthy, fit people who have come into contact with COVID have really struggled. So it's something that, it really has affected both people who have been immunosuppressed and as well as healthy people. And again, there's been patients who have been asymptomatic and, have had COVID, but there are patients who do have long haul symptoms. And I know a lot of people have really discussed this in terms of the brain fog. They may feel extremely fatigued, where they're not able to really, get moving again, like most, a lot of lupus patients. They may have again, the prolonged loss of taste and smell. They may have joint symptoms as well. And again, a lot of them complain of just not being able to exercise as well and have shortness of breath. So we are seeing a lot of patients with long haul symptoms, more so than I thought I would see.
Wow. When you were talking earlier about the College of Rheumatology, what was that website again where people can actually go and read about these different medication guidelines that they have for lupus?
Yes, it's rheumatology.org. And you could also Google the American College of Rheumatology. It's right on their website. They have COVID vaccine questions as well as recommendations. So again, it doesn't replace a physician or clinical judgment, because again, every patient's different, but it does give some guidelines as to if you're on a certain medication, what you should do, and then if there's any modification to the dose or the timing of the vaccine.
So I have one other question for you, and it's sort of out of left field. So we sometimes hear about triggers before getting a diagnosis, and sometimes those triggers are because people are pregnant or experience a trauma or get a serious illness. Do you think actually someone that is genetically predisposed or might have minor symptoms getting COVID could be that trigger for lupus symptoms to come out really for the first time?
Again, that remains to be seen. We do know that with certain autoimmune diseases, some viral illnesses have been, triggers, as well as sometimes the onset of pregnancy or post-pregnancy can trigger some autoimmune diseases. So it is something to look out for. Obviously, again, I'm a rheumatologist, so I'm very sensitive to that when patients do come in after any viral illnesses and then and then they may develop like any autoimmune disease. It's a possibility, but obviously there has to be so much research done at this point. And I think now that we are 1 year into this pandemic, or over a year into this pandemic, this is something or these groups of patients will be investigated more. Remember in the beginning, now all these autoimmune disease groups weren't really included in trials initially, but I think they will be included going forward. But it is something to keep in mind because again, everybody's immune system is so different, and you never know what will trigger. And we don't know what genetic predisposition we each have really, unless you go looking for it. Right. So again, it is, there's always this thing called a two-hit hypothesis, where there's a trigger and there's a genetic predisposition. And again, it could be a possibility, but obviously more research needs to be done about this.
Oh, we will continue to keep an eye on it, and I'm sure we will have many more interviews. I'm so grateful for you. You're always a wealth of information. So I want everyone to have the opportunity to follow you and get to know you, because you have an amazing social. So please let them know, like, your website, your social media, so they can come and just become a fan.
Thank you so much. I love advocating for lupus patients and autoimmune disease patients, and love educating. You can find me on Instagram at Dr. Maggie Cadet, or on my website, personal website, www.maggiecadetmd.com. So check it out. And again, continue the social distance, wear your mask, even if you get the vaccine. And right now, probably lay low on the travel until things have improved.
Definitely. Thank you so much.
Thank you.
Definitely go and follow Dr. Maggie. She's amazing. I will put her social here as well. And if you have any questions, feel free to leave them in the comments below about COVID and lupus. And, hopefully you'll be able to check back and be able to answer any of those that we get. So thank you all for spending another TILLY episode with us. Thank you again, Dr. Maggie. And I hope that you all tune in next week, and we will see you soon. Take care.